Wow, you're still drinking soda?
Yeah, it's Zevia Creamy Root Beer.
Isn't soda full of sugar and bad?
Nah, Zevia doesn't have sugar or fake like other sodas.
Okay, but does it taste like?
Here, try one.
Oh, this is delicious.
Told you. Zevia. It's soda made better. No Find Zevia Creamy Root Beer, Orange Creamsicle, and more flavors at your local grocery store.
You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, how to prevent vision loss as you age.
You can prevent vision loss and you can maintain someone's vision for life if you manage it appropriately, and especially if you manage the systemic condition.
But first, should infants get cochlear implants?
Okay, this is not life and death. This is life-changing. You need language to build cognition, so to develop your thinking, your IQ ultimately.
All that and more this week on In Good Health.
Wow, you're still drinking soda?
Yeah, it's Zevia Creamy Root Beer.
Isn't soda full of sugar and bad?
Nah, Zevia doesn't have sugar or fake like other sodas.
Okay, but does it taste like?
Here, try one.
Oh, this is delicious.
Told you. Zevia. It's soda made better. No Find Zevia Creamy Root Beer, Orange Creamsicle, and more flavors at your local grocery store.
Listening is the first skill we develop. At just 18 weeks in the womb, babies begin hearing language and rhythms, and it's not simply for entertainment. At this very beginning of life, it's helping to shape our cognitive development and how we learn to communicate.
Most of us take our hearing for granted. It's on all the time. And I don't think that the recognition between hearing and language is that obvious to people. And what's really not obvious to people is you need language to build cognition, so to develop your thinking, your IQ ultimately. And hearing is really important part of that.
That's Dr. Nancy Young, Medical Director of Audiology and Cochlear Implant Programs at the Ann and Robert Lurie Children's Hospital of Chicago. She's also the Lillian S. Wells Professor in Pediatric Otolaryngology at Northwestern University Feinberg School of Medicine. Prior to America implementing newborn hearing screenings in the early 2000s, Young says kids weren't usually diagnosed until they were 1 or 2 years old.
Why were they diagnosed? Because absence of spoken language. So at that point, it was like, wait a minute, there are no words. That's not to say there weren't some signs, but they're subtle. I mean, these children were not understanding and following directions like young children do before they start talking themselves. But there's other reasons children are delayed in their language, and there are other ways we interact with children that can be misleading, like visual cues, and, they seem to be interacting to some degree. And parents, it's a really sneaky problem, especially for first-time parents.
Thankfully, every state now has a universal screening program for babies that's done very soon after birth. It's this test that alerted Eva and Doug Tweedy to their daughter's hearing issues.
The day she was born, they came into the hospital and they did the routine newborn hearing screening. And they said, it's just something we come in and do. So we didn't think too much of it. But she did not pass on that first day. They said nothing to worry about. It could just be fluid in the ears from birth. So they came in the next day. She didn't pass again.
After a couple more failed tests in the following weeks, the couple brought their daughter Ella to Lurie Children's Hospital for more in-depth testing. They discovered that she had profound bilateral sensorineural hearing loss. It meant that Ella had almost a complete inability to hear sound in both ears. Guided by Young and her team, Eva and Doug were able to fit Ella with hearing aids at just 2 months old.
We got into earlier intervention by 2 months old. She was going in and getting fitted. And I remember all the audiologists making comments about how small the actual insert of the hearing aid was. So yeah, she was hearing, well, hearing through a hearing aid relatively early.
But this was just the first step in Ella's hearing journey. While the devices helped restore some hearing, Ella needed a cochlear implant to be able to grasp the full spectrum of sound and language.
I remember that, we were doing this one baby bouncer and we were making this kind of like a scaled sound. And, she kind of was able to copy us in that, right? Obviously it's so hard to tell with a kid because it's not like they're understanding the words, right? So you have to kind of go through a pattern of there's like these key sounds that you need to kind of be able to have them imitate. And so there's definitely recognition of some of those high frequency sounds, those high S's, right? That's where we started to see that breakdown of she's not getting that full recognition of that sound.
And you have to realize that in English, hearing soft, in all languages, but especially English, the soft high frequency consonants like S is so important in English. Is it singular? Is it plural? I mean, it's in so many words. It impacts meaning. And when you get into the severe to profound range on an audiogram, a hearing aid just can't make those soft high frequency sounds audible. So that makes it very, very hard to learn to understand what's being said and to learn to talk clearly. You need to hear those soft, high frequency sounds.
Young says that when cochlear implants were first being used, they were only really given to patients with severe hearing loss, which means very few kids were considered good candidates.
I can remember parents who were informed your child is not a candidate, and they would see their child in the same classroom as the child who got it. And they'd be like, that child's doing a lot more than my child. My child should have it. So I think there was a lot of feedback to clinicians in the early days that these criteria are too rigid because the kids who have the implant are surpassing these other kids.
So as the technology's improved, it's widened the scope of how much progress can be made for people at various levels of impairment.
So nowadays, we have patients who have a lot of hearing loss. It could almost be normal in the very low frequencies, but then it sharply drops off. And so they're not getting enough information for spoken language to be intelligible, to understand words are being said at a normal conversational level. So they are now candidates. And we can often, using special techniques, we can often preserve much of that acoustic hearing that they have and then bring up the rest of their hearing with what we could call electric hearing through the implant. But that said, the majority of patients who get implants have major hearing loss throughout all of the frequencies important for understanding what's being said.
There are multiple assessments done to figure out who's a candidate for the implant that include both parent surveys to look at auditory behaviors as well as MRIs to look at the patient's anatomy. And though it's been well established that hearing is an integral part of child development, most implants have only been approved for use on babies 12 months and older. Young says this year benchmark is forcing the kids to miss critical parts of development.
We normally spend quite a bit of time hearing so that we can attach meaning to what we're hearing, and then it starts to make sense as language, okay? And there's decades and decades of research that show getting that hearing to infants as close to what normally occurs is advantageous, that speeds up the process, that minimizes the likelihood of language delay and maximizes the likelihood of developing age-appropriate spoken language.
Which is why other countries like Australia and Germany have much lower age requirements. The 12-month limit is set in place for safety, but the good news is global research and clinical experience have shown that doctors can safely and successfully implant a 7-month-old, and Young says she's done it even earlier with great results. But there are still a lot of barriers for these kids to access treatment without the FDA approving a lower age limit.
Without that FDA approval, there's tremendous insurance barriers in the United States to getting the treatment because commercial insurers and then state insurers will often, they don't have to, but they will often look to the FDA approved indications and then set their policy accordingly. But that's not what those indications were actually developed for. So unfortunately, then companies have to invest a lot of money despite other information out there from people at the front lines like me, okay, often have to invest a lot of money in doing these formal clinical trials to change the approved indications and reduce the insurance barriers.
Thankfully, the FDA has increasingly been accepting real-world data and evidence from international sources as support for its regulatory decisions. That means that Americans don't have to go through the entire extensive research process if it's been thoroughly proven to be safe and effective in other countries.
And so the manufacturers now can work with centers and submit real-world data, and in many instances, broaden candidacy criteria and reduce insurance barriers. But that's a relatively recent change. It was not available at the time. The clinical trial that I led for Med-El, that was not an option then. So we really needed to conduct this clinical trial, and kudos to Med-El for making this important investment that's going to benefit all implant candidates in the United States.
Young's clinical trial with Med-El, a medical technology company that specializes in hearing implants, aimed to expand the patient age for cochlear implants. The research was successful and was used in the FDA's recent decision to approve implants for kids starting at 7 months old. Though Ella's now 7 years old, she received her cochlear implant at 7 months and participated in the study in a retrospective participant group.
There was a prospective and a retrospective arm. Prospective are the ones we were following in real time as opposed to had in a database. There was no difference in terms of any type of complications from either surgery or anesthesia, but very low rate, very safe, and no increased risk with doing these younger infants. Many of these children exceeded the performance of your average hearing child by 12 months of cochlear implant use if they were implanted under age 12 months.
Join us next week as Young details the cochlear implant procedure and the therapy process that's needed for a successful hearing journey. You can find more information about Dr. Nancy Young and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our executive producer is Amira Zaveri. I'm Kristen Farah.
Coming up, the diseases that can cause blindness when left untreated, when In Good Health returns.
Wow, you're still drinking soda?
Yeah, it's Zevia Creamy Root Beer.
Isn't soda full of sugar and bad?
Nah, Zevia doesn't have sugar or fake like other sodas.
Okay, but does it taste like?
Here, try one.
Oh, this is delicious.
Told you, Zevia. It's soda made better. No Find Zevia Creamy Root Beer, Orange Creamsicle, and more flavors at your local grocery store.
Our entire life experience is influenced by how our 5 senses perceive the world around us. The sound of soft waves crashing at the beach, the feel of sand between your toes, the breathtaking view of a sunset over the ocean. Our abilities to touch, hear, see, smell, and taste are both invaluable resources and things we often take for granted. That is, until we lose them. Millions of Americans experience vision loss, and Jeff Todd says the numbers are continuing to rise.
There are studies out there. We are seeing an increase of prevalence of eye conditions, certainly of some eye conditions, partly because of the increase in rates of diabetes. I think it's also somewhat due to some of the changes in the demographics of our society, and so we are seeing increased rates.
Todd is the president and CEO of Prevent Blindness, the leading eye health and safety organization dedicated to preventing vision loss. Part of the demographic changes involve aging and more people living with chronic diseases.
We're seeing increases, I know, in the rates in the percentage of our population that is Hispanic or Latino, and there are certain conditions that Hispanics and Latinos are susceptible to that others aren't, and that's true of other races as well. So as we see changes in those demographics, it definitely has an impact.
Yeah, and I think as we're seeing an aging population, So we're seeing an increased aging population. We're thinking about things like age-related macular degeneration or cataracts and so forth. I think also when we think about diabetes, that's a big one. So over 40 million diabetics in this country, and the more that you're seeing diabetes, the more people at risk for diabetic retinopathy, which is a preventable cause of blindness worldwide.
That's Dr. Paul Chan, chair of the Department of Ophthalmology and Visual Sciences at the University of Illinois, Chicago. He's also a board member of Prevent Blindness. He says diabetes is one of the biggest risk factors to focus on because the vision loss it can cause is preventable. Chronically high blood sugar can weaken the blood vessels in the back of the eyes, reduce blood flow, and cause abnormal vessel growth. Thankfully, this progression can be stopped in its tracks by properly managing the diabetes.
Other conditions that can also affect the eye in not older populations, high blood pressure, right? That's something that we can all control, but can also affect the eye. Inflammatory conditions, right? So my partners manage uveitis, so inflammatory eye disease. Trauma, that's another issue that we face. One of the other things to think about too is that if you have a family history of glaucoma and so forth, it's really important to get plugged in early and make sure that you're seeing someone to manage that appropriately. So all of these things matter. So that's kind of what it means to maintain eye health, is that even if you don't feel anything, this is, part of the discussion, you still need to get care.
Staying on top of your eye health is so important because even people with no known conditions are still at risk by just simply getting older.
And age does have an impact, even for those, I think, especially like in their late 40s, early 50s, we're seeing changes in our eyes, such as presbyopia, etc. And so it's really important as we age, as we get into our 40s and 50s, to pay extra care to making sure that we're getting regular eye care.
Presbyopia occurs as a normal part of aging. It's when your eye lenses become less flexible, which causes you to gradually lose the ability to clearly see objects close to you. Though you can't prevent presbyopia, managing the symptoms can really increase your quality of life, which is why having regular check-ins with your eye doctor is important.
Your eye health is really a part of your overall health. And so it's about eating healthy, exercising, doing all of those things, but also seeing your eye doctor at regular intervals, especially as we get older. I'm in my late 50s, and it's really important for me, even though I don't have any signs or symptoms of conditions other than slight vision challenges, to see my eye doctor on a regular basis in case something should come up that I should be giving more attention to.
Unfortunately, Todd says too many Americans aren't keeping up with their eye health. It's recommended that even adults with no existing eye problems get a baseline eye disease screening every 5 to 10 years before the age of 40, which is when age-related issues often show up.
Prevent Blindness recently conducted a survey and found that 75% of adults don't understand that they may have an eye health condition that doesn't come with symptoms. And so that's why it's so important for people to have regular eye care and to be tuned into their eye health. We've heard way too many stories of people saying, I wish I knew, or I wish I knew this earlier, I wish I'd sought care earlier. And so that's a big part of our Best Eyes for Life campaign, is to make sure that people are checking in on a regular basis on their eye care.
The Best Eyes for Life campaign reinforces key parts of eye health, such as nutrition and protection.
I occasionally get people asking the whole thing of, should I be eating more carrots? Are carrots healthy for my eyes? My answer to that is always, well, it's not going to hurt to eat more carrots. And what I mean by that is anything you do that's healthy for your body is healthy for your eyes.
And I usually recommend with my patients leafy green vegetables, antioxidants, right? Things that are high nutrition. You want to subscribe to that, right? So it's absolutely necessary to have a healthy diet.
Nutrient-dense foods that are high in antioxidants help protect the tiny, delicate blood vessels in our eyes. Vitamin A, found in sweet potatoes and cantaloupes, is helpful for turning light rays into the images we see, and at preventing dry eye. Antioxidants found in kale and spinach protect the macula, and vitamin C helps repair and grow new tissue cells. But as we strengthen our eyes from the inside, Chan and Todd say we can't forget the external protection.
We're seeing so much more over the last few years of people playing pickleball. Well, people might be surprised that one of the highest rates of eye injuries these days are pickleball accidents. So wearing eye protection when you're out playing sports, pickleball, tennis, baseball, other things is super important. So when you see your neighbors out on the court playing these games, tell them to get a pair of protective eyewear.
I walk around and I see people doing things, I'm like, oh, you should be wearing eye protection. It's so important. I mean, I'm a retina surgeon, so I've seen a lot of patients who come in with eye trauma, and if people were wearing eye protection, could have avoided losing one eye.
Even throwing on your usual pair of sunglasses is a great way to protect your eyes from both UV damage and physical debris. Both Chan and Todd note that managing your eye health isn't just for adults. The best time to start taking these preventive steps is as a kid.
Kids can't always tell us what's going on, but there are clear guidelines around when to have your child see an eye care provider, so see the pediatrician, or when they need to get those eye exams. So things like lazy eye, strabismus, all of these things can be caught early. I think one of the exciting things is, we're starting to see therapies for gene therapy come to market, right? Ophthalmology was one of the pioneers in that space, right? So we're starting to see things where we can manage children earlier for different conditions. For example, amblyopia, if you approach it early on in that window of time, you absolutely can maximize a child's vision, right? So that's why you want to get them plugged in early to the pediatrician and to the eye care provider. You can prevent vision loss and you can maintain someone's vision for life if you manage it appropriately, and especially if you manage the systemic condition.
You can find more information about Dr. Paul Chan, Jeff Todd, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
Wow, you're still drinking soda?
Yeah, it's Zevia Creamy Root Beer.
Isn't soda full of sugar and bad?
Nah, Zevia doesn't have sugar or fake like other sodas.
Okay, but does it taste like?
Here, try one.
Oh, this is delicious.
Told you, Zevia. It's soda made better. No Find Zevia Creamy Root Beer, Orange Creamsicle, and more flavors at your local grocery store.
On the under $3 menu at McDonald's, a McChicken is $2. Because when you're craving a McChicken, you deserve a McChicken. And now, that McChicken is just $2.
Limited time only. Prices and participation may vary. Prices may be higher for delivery.
Medical notes this week. That disposable vape in your pocket may become significantly more hazardous the longer you keep it. A study in ACS Omega shows that the remaining fluid in high-puff e-cigarettes accumulates toxic chemicals as the device ages. Lab tests reveal that heavily used e-liquids are more toxic to human lung cells than fresh ones, meaning the final puffs of a vape deliver a much harsher dose of cellular damage and inflammation. A better way to diagnose complex brain disorders. Research published in Alzheimer's and Dementia reveals how an AI tool can analyze a blood test and distinguish between 4 major neurodegenerative diseases with over 92% accuracy. The test can even detect when a patient suffers from multiple overlapping conditions simultaneously, paving the way for inexpensive screening and highly personalized precision treatment. Your mental well-being may be dictated by your weekly budget. A study in the Journal of Business and Psychology has found that minor, unexpected expenses, like overspending on a social gathering, spark far more daily anxiety than large, necessary costs like auto repairs. Conversely, small financial reliefs or incremental workplace bonuses provided immediate stress reductions that rivaled major long-term windfalls. And finally, the secret to conquering mosquito season might be sitting right in your pantry. Scientists have discovered that a natural compound in garlic completely shuts down mating and egg-laying in mosquitoes and flies. By stimulating specific bitter taste receptors on the insect's organs, the compound triggers an immediate aversion that acts as a sort of birth control, opening the door for highly effective, eco-friendly pest management. The findings are published in the journal Cell. And that's Medical Notes this week. I'm Mayan Voss.
Wow, you're still drinking soda?
Yeah, it's Zevia Creamy Root Beer.
Isn't soda full of sugar and bad?
Nah, Zevia doesn't have sugar or fake like other sodas.
Okay, but does it taste like?
Here, try one.
Oh, this is delicious.
Told you. Zevia. It's soda made better. No Find Zevia Creamy Root Beer, Orange Creamsicle, and more flavors at your local grocery store.
Tibetan Court.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.
Wow, you're still drinking soda?
Yeah, it's Zevia Creamy Root Beer.
Isn't soda full of sugar and bad?
Nah, Zevia doesn't have sugar or fake like other sodas.
Okay, but does it taste like?
Here, try one.
Oh, this is delicious.
Told you. Zevia. It's soda made better. No Find Zevia Creamy Root Beer, Orange Creamsicle, and more flavors at your local grocery store.